Is thioridazine safe while breastfeeding? Have you ever wondered about the safety of medications during breastfeeding? Today, we are focusing on thioridazine, also known as Mellaril, a first-generation antipsychotic used primarily for treating schizophrenia. Thioridazine works by blocking dopamine receptors in the brain, which helps manage symptoms of schizophrenia. But what about its safety for breastfeeding mothers? When it comes to thioridazine and breastfeeding, there are some important considerations. One of the main concerns is that thioridazine can cause hyperprolactinemia. This is a condition where the body produces too much prolactin, which can lead to galactorrhea. Galactorrhea is the spontaneous flow of milk from the breast that is not related to childbirth or nursing. While this condition might not directly affect a mother's ability to produce milk, it does indicate that thioridazine can influence lactation. Now, let's talk about the specific concerns regarding thioridazine while breastfeeding. There is limited data available on how thioridazine affects breastfeeding. In fact, there is no published experience with thioridazine in breastfeeding mothers. Because of this lack of information, healthcare providers generally recommend using alternative medications, especially for mothers nursing newborns or preterm infants. The safety of thioridazine in breast milk has not been established, which raises caution. For individuals with schizophrenia who are breastfeeding, it is essential to consult with a healthcare provider. They can help weigh the benefits and risks of using thioridazine. Given the potential risks and the limited data, healthcare providers often suggest considering alternative antipsychotics that have a more established safety profile during breastfeeding. Managing schizophrenia while breastfeeding requires careful consideration. It is important to balance the need for effective treatment with the safety of both the mother and the infant. This might involve choosing medications that have more documented safety profiles or closely monitoring the infant for any adverse effects if thioridazine is deemed necessary. In summary, while thioridazine can be effective for treating schizophrenia, its safety during breastfeeding is not well established. Consulting with a healthcare provider is the best way to ensure both mother and baby remains healthy and safe.